response and the development phase also. And in the twin track, I was mentioned that we have adopted the twin track approach, not only the cross-cutting themes. That is the most important and the best practices in the Nepal, because the need is different. Even the PGI situation is the very vast, and the expectation from the Red Cross is very higher than our capacity. So sometimes we need the piloted, sometimes of some kind of the specific programs like disability inclusion and the violence prevention, PGI capacity building in the child marriage, those type of thing project also needs side by side while we are implementing the cross-cutting themes as a PGI in the other DM and the other programs also. And also Nepal situation, main lesson learned is we have a strong foundation in the organizational level, and our HR, technical HR is available in the nationwide. We have a gender PGI committee in the 44 districts out of the 77 districts. So almost we plan to reach in the almost all districts to work as a network in the nationwide. And also we have established the interdepartment networking in the national society level, and also we have established the network in the regional level to support the one to another national society in the PGI field and sharing our learnings. And the coordination collaboration from the national, local and the regional is very crucial. It's our best learning, and survivor center approach is always crucial while we are responding the violence survivor and addressing the SCBP needs also. During the COVID-19 response, we have worked together with my time. I have allowed.
Well, it's very important to hear this last part. We are getting to the end, but please do go ahead for that last part. I'd really like to hear it. Thank you.
Okay, then coordination, collaboration is the main part with the local and the national stakeholder. We have partnering with the UN agency, government agency, other civil societies during the COVID-19 response, COVID-19 response also. And we supported the other LGBTIQ plus communities organization and other disability inclusion organization by providing the direct support, kids support, whatever they need during this pandemic time also. And we train the women and other, even we youth mobilization is our main part, because the youth are mobilizing in the response of the, even in the earthquake response operation, in the COVID operation also. So these are the major part of our best learnings. And challenges, in terms of challenges, all of you already know that the Nepal is a climate-based, disaster-prone country, and we have a diversity. This is a strong point, but a stereotype of discrimination leads towards the violence also. And there is a law, constitution, everything, participation, access of the women and the other peoples in the policy, law, everything is in the document, but in the practice, there is a lots of the gaps. And while we are allocating the budget in the government side, from the government side, and also in the other national civil societies and also international society, it is always in the less priority. So scope is wider, because we have to work in the organizational level also, and we have to work in the programmatic level also. And we have a different kind of the program, DM and the resilience and the WAS and the youth development, organizational developments. So many programs are all side by side. We have a responsibility to strengthen the capacity of the organization also. The PGI scope is very wider, but fund and the technical support is the limited. So these are the major challenges. And also one of the emerging challenges is the social media roles, and its impact on the youth is emerging challenges. In the Nepal, not only in the Nepal, it is
so sorry. I'm going to have to ask you. I'm so sorry to interrupt. It's the last thing I want to do is to stop the Nepal Red Cross from speaking, because you do the most fantastic work. I don't know, it's really, really hard to fit it into the 7 minutes. We're just going to have to move on to the next person. But what I would like to ask is for when we get to the questions and answers, for everyone to please ask any additional questions they have for the Nepal Red Cross, because there's just so much to cover for the Nepal Red Cross in particular, but thank you so much.
Thank you so much. Thank you.
But you have really raised, I mean, just so many things, but especially one thing that I'd like to actually ask of Irdim when you go to the next speaker. I'd like to just ask if we could please speak about, Pooja mentioned some really, really interesting things about combining institutionalization, so organizational capacity, with programming focuses. And I think that there's often a lot of times where I've spoken to national societies and it's quite difficult to combine the two. And I would imagine that for a national society that has such a fantastic comprehensive protection program, that would have required a very specific, a very focused, application to both institutionalization and programming. So if you could perhaps speak about that, but then also, of course, just more broadly, your experiences over the past 5 years. Thank you.
Thank you, Daniel. Thank you, everyone that participated to this webinar. Before starting, I just wanted to say that when I see the report of five years achievement, I just feel a little bit excited, actually, because it was a very touchy work document when I see all these developments within that years, and which was actually quite overlapping with the Turkish Red Crescent development, institutionalization of protection within the organization itself. So that it was it's great honor and privilege for the movement. This is what I'm thinking. And thank you for all the movement stakeholders that contributed to that. It's also very pleasing to see that the movement, the PGI policy is on the way, and we will see that in the coming days, as far as I know. Well, before answering your question, just briefly, I just wanted to say that how we started our protection programming inside the country as Turkish Red Crescent. Now, currently, we have a very comprehensive protection programming in which we are involved in SGBV, child protection, mainstreaming activities, creating some referral pathways, human trafficking, RFL, and even detention monitoring. And the last but not least, one of the most important thing for us is the community-based protection activities. Well, when we started the protection work, it was not actually a deliberate action. It was it just evolved in an organic way, quite natural, because we started working on psychosocial support, and we established community centers to provide some psychosocial support for the people that were affected by the Syrian crisis. Mostly they were refugees. And then after people came to these places, we realized that these people needed more than psychosocial support. So that, for instance, they had some problems to access to the basic services. They had several problems on violence. And I mean, we think that we built up a civilization in the blocks, in the apartments, but we realized that the horrible situations were concealed in these blocks and apartments, actually, because domestic violence were in there, and we experienced that during the COVID phase. And then we requested some support from external stakeholders, like our partners. What could we do? And we tried to find some solutions within the movement, and it was quite shocking that we couldn't find any ways or any means for responding to the violence cases or SGBV cases within the movement. It was quite a big lacking situation, actually, in 2000s, let's say 14 to 13. So that this is why I'm saying that when Amjad was mentioning the timeline of the development of PGI, it is a great. It is actually indeed a touchy process that everyone saw that there had been a lot of evolving processes. And one of the things that when we started, then we asked what is protection, and everyone is discussing that, and even today we are discussing that. I think it will be an endless conversation within the movement and within the protection actors. But when we were asking that what is protection, we tried to exercise what we understand by saying what is protection, so that we tested. We failed a lot. We developed our programming by great failures. Well, we said a lot of we shouldn't be doing that during the case management processes. Like we should develop some SOPs for the interpreters. We should facilitate some of the tasks for the case workers, so that it was a complete evolving process. And at the end, what we see is we are now, I mean, with all these mainstreaming within the national society and within the external stakeholders, now we are contributing to the policies, both national and international policies. And it is very, I mean, pleasing situation, actually. We are very grateful to be there as a national society. One of the things that I should mention is, I mean, within the movement, this might be something very unlikely. We really think that leadership matters a lot, but our process of building up a protection action was not coming from the leadership, actually. It was coming from the below. Very committed, very I mean, people that really believed the positive contribution, positive outcome of the action made us believe that that there would be a solid protection programming. And then we tested, we showed, I mean, we had a lot of showcases for the leadership. And now there is a commitment of the leadership. I mean, at the end of that, all the ambition, let's say. But it is also important to get the support of all the volunteers, all the people that are, all the protection actors on this at this stage. That there should be some commitment, and they should understand what we think as protection. And last thing is the partnerships that we developed, especially for advocacy and for the capacity building, because we developed a lot of partnerships specifically for this purpose, to building up certain policies inside the country, and also building up some capacities with the small NGOs inside the country. And we really proud of that achievement within 5 years, not just in Turkish Red Crescent, but within the movement with all our art. Thank you, everyone, for listening to us. I hope that you enjoyed my presentation, let's say.
Thank you so much, Erdem. Yeah, I mean, I know you only spoke for a brief amount of time, but I know there is absolutely so much more to be heard from the Turkish Red Crescent. Even just from my own, personally from my own research, just the work you do is fantastic. And I noticed someone mentioning in the chat, I didn't see who it was. It might have been Lisa, but just saying that the bravery that the Turkish Red Crescent has shown, especially over the past 5 years, is just absolutely fantastic. So thank you so much. You've also reminded me, again, of something I'd like to ask the next speaker, which is Millinois at the Africa region. Erdem mentioned not only that, the referral pathway deals with so many different diverse needs, but also that some of the most important sort of groundswell for change and for protection often comes from people operating at the ground level. So Millinois, I wanted to really say, as the PGI coordinator for a region as absolutely diverse as the Africa region, in terms of needs and in terms of identities. How have you managed to engage national societies which are protecting people who have such different profiles over the ground and on the ground, and how have you managed to do that over the past 5 years? I'm really just in awe of your ability to handle all of that.
Thanks, Daniel. So I think that's a really good question. But I think the reality is that we started from where we are and just identifying Where are we? And for me, I'm looking at not only 5 years, but for Africa region, I'm looking at least the last 3 years from end of 2018 to now. I was trying to reflect this morning, and I think we started with a conversation. The reality is that we just started having a conversation with different national societies, reaching out and doing a basic mapping, because we, like you said, the needs are really, really diverse. National societies are at all different levels. Some national societies are doing really, really well in terms of PGI, and some are still starting in the process. So it's really to identify where are we at, the different national societies, what are the support needs, what are the gaps, and having that conversation at that level, and not only engaging PGI focal points, but also the national society leadership. So this, I must say that it was very, very critical to have IFRC regional leadership support as well, to have the conversations with leadership, for example, to ensure that we have PGI focal points to work with, for one, to ensure that we have contact people on ground and having honest conversation on what we do. So our approach was very national society focused in terms of their need. It was not a one-off approach, and it was really guided by the needs of the national society. So our priorities were having a conversation, all of us, and saying, what is the priority for Africa region? So how do we support each other? And one thing really stood out is that national societies also requested a lot of peer-to-peer learning. They wanted to know, I want to know what Southern Sudan is doing. Liberia wants to know what another country is doing and who's doing well on what as well. So a lot of requests for peer learning and how do we make that happen as well. So I think having the conversation together as a team in the region and identifying what do we need to do, what are our priorities, and how do we make it happen as well. So I think for us, that really worked well, where we started with a basic mapping of Africa region, one-on-one conversations with each national society. It was quite a task, but I think it was super, super useful, because that is what has brought us to where we are today. Having one-on-one conversation with each national society, discussing and identifying priorities, mapping out how do we then address the different support needs. I think another critical component as well was working very closely with the partner national societies who are working in Africa region, who are super instrumental as well, and supporting that process and brainstorming together as well, and saying, okay, maybe we need to coordinate and see who's doing what where, and how do we work together to ensure collaboration and coordination in the movement as well. So I think a lot of that really enhanced our work. And just seeing what are the best practices, starting with a few national societies, them sharing, and other national societies wanting to learn from others as well. I think it's been a growing progress. And to just say that if we look from where we started, just the conversations from 2018 to now, it has really, really grown. We're getting so many requests. There's so much progress in national societies in terms of PGI. I'm sure you can attest in Southern Africa, for example, where we're getting more national societies recognizing the need for a full-time PGI manager in place, and just recognizing even the work that the PGI focal points who have other multiple tasks in place, really going out of their way to ensure that PGI is a priority in the national society. So I think that has been really super instrumental for us as well, to see the need and the persistence of all the PGI focal points, the national societies who are putting all the work into it as well, and recognizing the needs. So what came in after that is that we saw a lot of requests, and people are saying, okay, PGI is a priority. Then really we need to do something about it as well. And the growth, not only in national societies, but also in IFRC as well. We've grown from a team of 1 to a team of 5 PGI in Africa region. I think that's huge progress for us as well. And this, I must say, it's not only because of what all we're doing in Africa region, but it's also partner national societies supporting, PGI colleagues in Geneva supporting as well. Working together as a team has really been helpful to us, and strategizing together as well, just prioritizing what is important in Africa region at the moment, recognizing that we can't do everything. PGI is so huge, so what is our priority? How do we do that? So that has worked very well for us. And I must say that in terms of national societies now, from where we started up to now, we have so many, around 40 PGI focal points. So having conversation, we literally have a regional PGI network where focal points say we need to speak more, we need to know who's doing what are the best practices, how do we practically do this? So having those conversations have really, really been useful for us, and putting them into action by one-on-one support. There's been increase in emergency operations for us as well, where just supporting one operation by another and another, slowly and slowly, a lot of support from the ops team as well. So that has been really, really super useful for us. Yeah, but I must say, maybe as I finish as well, is that for this to work as well, we realize that in integrating PGI, we need to work not only with the PGI focal points and the leadership, but also the different teams in WASH, health, DM, national society development, youth and volunteering, PMER. This has been the core teams as well in FRC, who have made the connections with national societies, ensuring that these teams as well understand the importance of PGI and how to integrate that as well. So that has just been our journey, but I think it's been a great journey of learning. And today I was just trying to analyze and see how far have we come. And I couldn't even write it down because it's a lot. We've come really a long way from where we are up to now. And now there's so many requests. We're like, okay, maybe we need to build a bigger team. Oh my God, we need more money. Oh yeah, right. We are getting so many requests. We need surge people. People need to be deployed in the field because we are getting requests as well.
Exactly.
So that was super useful for us. I hope that's useful for now. Yes.
Thank you so much, Milano. Yeah, no, I mean, I don't want to congratulate the Africa region too loudly because I'm part of it, but it really is just so fantastic to see the work that has been done in Africa. And as I mentioned, I've only been here for under 2 years, so seeing the progress has just been absolutely amazing. I must say something I definitely know from my work in the Africa region is exactly as you were saying, starting from engagement with each national society, but especially as you were saying, peer learning has been fantastic. And I think actually something that I must say about the Americas region coming to Evelyn as my last speaker is that I think something I've really been grateful to see from the Americas region especially is not only learning, but acting on that learning for innovation. I must say every time I'm on a call with someone from the Americas region, you're either always coming on from another call or about to join another call. So I can definitely see how busy you all always are. But if you could maybe speak in the last few minutes before we finish this panel discussion about just the most incredible innovation that the Americas region has been doing, especially to meet people's needs that we've already been aware of throughout the Federation, but in just ways that are so much more creative than we might have thought of previously.
Thank you so much, Daniel. Well, it's a pleasure to be here, and of course I want to say that to be representing the region with so many great people that are building PGI in Americas is an honor for me. So I hope to be fair with the information I'm going to provide. And talking about innovation, it's very interesting to see the perspective of innovation. For us, innovation was both to have key mechanisms of technical capacity, but from the other side, to show an easy, concrete, and practical way to understand PGI. So for us, we understand PGI is a very big umbrella, and in regards of that, how to explain it better for the national societies, how to make sure, as Milano was saying, that all the areas know their part with PGI was our main challenge, and if I may say, our innovative part of how to do it. Americas has always been very representative in terms of social inclusion initiatives. We know social inclusion needs to be at the forefront of our actions with programs such as friendly neighborhoods, such as community-based health, and also friendly schools. So for us, the cultural integration is also key in regards to building what we want to do in terms of protection. The other thing was how to do it interesting in emergencies, because we know that there is a lot of interest on how to merge properly PGI in emergencies. So we have two vortexes, if we can say so. For one side, to build with the disaster managers, with the disaster counterparts in the national societies, with using the toolbox, working with the ERUs who are deployed in the emergencies. But from the other side, we also believe that emergencies need to have leadership that is inclusive, safe, and equitable. So we also have a regional strategy on gender equity in the leadership of emergency operations. And that has brought us an immense type of learnings, because we know that the first and foremost part is the people who are deployed and how they are trained. Right now, PGI is a mandatory briefing for all the delegates we are deploying. It's completely mandatory for them to receive PSEA briefings, child safeguarding briefings, but also to collaborate among us as PGI. The increasing of PGI delegates has been amazing, and I cannot feel more honored to be to see how the national societies are doing it. Another type of innovation, if I can say so, is to build our context-based tools. We know from Geneva and from other regions, for example, as Africa, which I have to commend the amazing tools they have, we knew that we need to speak in our language and in our context. So we focused on creating, for example, a regional guidance of safe referrals, how to safely refer in context of urban violence, in contexts such as as the one we have with an important amount of interpersonal violence, to build a context-based trafficking guidance and toolbox, and actually to build a GVV toolbox and new masculinities guidance. Because we know we need to talk to the national societies in regard to the context they are affected, to talk about machismo and to talk about sexism in our own words. And finally, but not less important, we knew that we need to communicate PGI. So how can we do it? And some of them you have seen it. So we have here like a quote to explain something very concrete. So let me explain it with Play-Doh. So we say, hey, what we should explain with Play-Doh what's PGI. So we created a set of videos about migration, about COVID, about health. How can you understand that have a people-centered approach, a survivor-centered approach, a do no harm approach is key for our humanitarian mandate, and how to communicate that. Right now, we're scaling up our efforts to show our commitment in regards of key matters such as the International Women's Day. We celebrate with the volunteers the Pride Day, because talking about diversity is always at our core. And that has created a very fertile space for building our small PGI network. Right now, we have a PGI network of 10 focal points. We also have more focal points coming. We have PGI officers hired totally in country clusters. So it's great to see the growing expectations, which is nice stress, but also the amount of requests on safeguarding, on trainings, on how to build with other areas. And finally, we're working in mainstreaming PGI. So very recently, we developed a PGI and WASH training. We are in the process of finalizing and testing our MHPSS and PGI training with an approach on gender-based violence. So we believe firmly in Americas that PGI cannot be done in silos. I firmly believe this is part of everyone's efforts to make a safe, inclusive, and dignified space for the communities we work. So I hope that's innovative. For us, it is.
Absolutely.
So definitely, it's been a journey, and a great journey.
Thank you so much, Evelyn, and more than enough, but I know not nearly half of what you're already doing in the region. So thank you so much for such fantastic presentations from each of the four panelists. I'm going to now hand over to Audrey, and then we'll come back after presentations from Stephen and Lisa for questions and answers. But really, just the most, really, as Yorgo said, the most inspirational testaments from each of the four of you. So thank you so much. I'm going to hand over to Audrey now.
Thank you so much, and great to hear about how things developed in your respective context. And to continue building on what you're already doing, I'd like to hand over to Stephen and Lisa, who can share their perspectives as coordinators from the Geneva PGI team, and who are going to present the development of this report and also make some connections with future priorities. Over to you.
Thanks so much, Audrey, and thanks so much to all of the speakers so far. It's been really wonderful to have this person-centered approach to going through the report, and I think it really captures a lot of the spirit of what is hopefully captured, and you'll have the chance to read through when you get the links that we'll share later to the full report. And we really wanted to start with focusing on what's happening in country and in region, but also wanted to give a little bit of an overview of the global picture. It's difficult to capture the global picture in thousands and perhaps hundreds of thousands of the individual stories. So we then try to capture it with data. And of course, it's two different types of evidence. It's an evidence-based report. It's about learning. It's maybe, not as exciting sometimes to look at numbers and graphs as it is to hear the stories. But of course, the graphs are all about the people who are behind those. So just to very quickly go through a little bit of some of the main points, there's, I think, 18 graphs in the report, and that they're telling the story that is they're illustrated then in all of the case studies and different examples. And we started out actually with assessing and what should we be doing, as some of the speakers had mentioned, not starting from nowhere, but saying, where are we, first of all? And one of the things that we quite quickly discovered was that there was a clear focus on child protection, on SGBV, and also on RFL in terms of the protection, gender and inclusion work national societies were doing. We did a very similar survey twice and came up with the same results. That's always very good for statisticians to see repeating patterns. We also saw that when we asked a second question about how many of you are doing protection mainstreaming and working with marginalized groups, that really the majority in that's the absolute number. The percentage of that was about 85% of respondents. So really all national societies, or the vast majority, really working on mainstreaming issues, and a significant amount also on child protection and SGBV, but not also on trafficking, maybe not as many, not a problem in as many countries, but where it is, we really see that as a prominent factor as well. And the type of work that we were doing, we also asked, are you more directly managing those cases of people who are affected by violence, discrimination, and exclusion, or are you referring to other actors? And as you can see, it's fairly sort of broad, evenly split. There is a bit overall more referrals, so national societies are having that role of knowing how to make sure that people are kept as safe as possible with the right people, but significant majority in some cases, and even a significant minority in others, are also doing the case management themselves, which is perhaps not always so well known about national societies, that they are directly taking the different types of care of people affected by violence, discrimination, and exclusion. Then we're looking at the type of guidance. We're always producing guidance in IFRC, in ICRC, and in other national societies as well. And we asked the question, are you using that guidance? And we're quite pleased, of course, to see 67% of people who were asked that in 2019 in relation to COVID. So that is the main tool, that you've produced is the main tool we're using, as much as the sphere principles, sphere handbook, and more than many of the other guidance for more generic people, more generic sort of humanitarian audience, which was really the purpose. So that was a good endorsement that tool, that guidance that you're sending out, yes, we're using it, yes, it's useful. Another bit of the assessment we did, and I'll just go through this very quickly, but looking at what are the types of the ways in which people are excluded when we were looking at the inclusive programming framework. And of course, it was very much across the board, very depending on different contexts, different country contexts, but we see from violence to livelihoods, to shelter, to employment, to education, all of these types of ways that national societies are working to include people who are excluded. Quite a different picture from one region to another. Also a little bit, though, perhaps in some of the regions where there isn't it doesn't appear so much in the reports, it's partly because it's not sort of thought of in that way. So it can be very protective work, very inclusive work being done, but it's given the label social care, or it's given the label care of the vulnerable. But actually, when you look at it, there's a real emphasis on working in that way. So in one sense, it's interesting to see the difference, but also to note that in Europe, people are very used to using the term social inclusion, and perhaps in Middle East, North Africa, it's called something else, but the work is the same. So we see some unity there as well as difference. Then looking at the progress, so all of that was a little bit gathering the evidence, and we see throughout the report different examples of how that's been done. And when we get into what we've been really then achieving over the past 5 years, really the bedrock, the foundation, the big push that we started on in 2016 was making sure that emergency response operations were inclusive, right? So there's really a big emphasis on that, very linked to the global surge review and the reform of the surge processes. The exact name I'm forgetting now, but I think those who are involved with it, you know what I mean, but making our disaster response better. And we saw that from 2016, we were already having PGI actions being done in emergency responses, but it does increase steadily year on year until the point we get to 2020, and it's the same for 2021, where every appeal now has a very solid PGI focus in it. Surge optimization, thank you, Lisa. So in that surge optimization process, we were very closely embedded and really was a very core reason why we were able to develop competencies, develop guidance, develop the whole PGI toolkit that many of you will know. And we see the fruits of that labor with every appeal having a section which we increasingly check for quality, and indeed, very much thanks to Kaiser Latila and so many of the team who worked on that. But a little bit more specifically, in the more specific areas, as we saw, we looked at the beginning, child protection and SGBV was the main work that National Society said they were doing. And that's the main work that we've been then supporting in the appeals and in the disaster, in the DREFs, in the smaller emergencies. And we see a similar kind of progression. It's a little bit sort of up and down. Of course, it's disaster dependent. It depends on many things, but the overall progression is more involvement, more analysis, more taking care of issues of child protection and SGBV. In the annual plans, which are perhaps sometimes forgotten about in some parts of the organization, but really, again, the lifeblood of IFRC offices supporting national societies in their annual programming. It's actually quite steady, showing that really, as Frank said right at the beginning, PGI has always been quite at the forefront of national society work. And a lot of the work we've been doing is consolidating, supporting that, and making sure that there's some kind of standardization. So here we see less progress, but we see a steady continuation of the same focus of national societies. So how do we do all of that? Well, we need more money. So we've been working hard to get more of that money, and some people on the call been really facilitating with that. And of course, we're eternally grateful on behalf of the people for whom we use that money to try to support. But it has been steadily increasing year by year. Nice to see, though, that the amount of people reached has been steadily increasing in a rather similar pattern. The money that we see is secretariat budgeting. The people being reached is federation-wide data, but we still see this correlation. We probably need a few more years for it to be statistically totally valid, but it's encouraging to see that as we have more money, more people are being reached, and more emphasis in the appeals and in the emergency response. And all of that to have more engagement in the reports, more money, and more people reached. We need more people working on that, of course. And this is a graph showing people outside of the surge environment. So national offices, regional offices, IFR and the Geneva office, the amount of IFRC PGI staff. You can see it's quite well spread from the cluster to the country to the region to Geneva. So we tried to avoid having a Geneva heavy distribution of staff, but still keeping a core team who can support the regions and the countries. Again, steadily increasing sort of year on year, with a bit of a COVID-related dip at the beginning of 2021, where everything, as we all know, went a little bit up in the air. At the same time, the surge deployments, so deployments to emergency response, again, disaster dependent, so there's maybe a little bit of an up and a little bit of a down, but the 2017, 18 and 19 increases are really related to that surge optimization and us saying, we need to, thank you for the spotlight. Yes, I forgot to spotlight myself. We really see the importance of increasing the capacity of people to the capacity of the organization to be able to respond, and then a little bit of a dip in COVID. So coming to the end of this data section, we really see, the usefulness of having all of that data there for us to see what the progression is, to see where there's gaps, but to really make the link between money and people and programs and make sure we're doing everything we can to make those links as strong as possible to really support, all of the work that we heard from our earlier speakers so well. And during all that time, we've been trying to learn those lessons, and I will then pass over to Lisa to give a little bit of a summary of some of the core, there's many lessons we've learned over those years, but to try to synthesize it into one or two of the key ones. Thank you, Lisa.
Thank you, Stephen. Yes, of course, the numbers, the quantitative evidence, we need that, but we also need the story, right? And the qualitative, lessons. And first, I have to say, I'm really touched by this. And it's amazing to see all of you and to really just sum up all of the crazy amount of amazing work that has been done over the years. And I feel super grateful to have had the honor and still have the honor to have worked with so many of you at very, very local levels, but also at a more global strategic level more recently. It's really nice to see all of you. And we're going to live off of this session for a long time, I think. Just to have said that, of course, we tried also, as you all know, because you all participated in capturing what are the main, like in a nutshell, lessons that we've learned over the years. And the way that we did that specifically was through the consultation and the joint network and community, PGI community development of our strategic framework for PGI. And that's now turning into an operational framework and a PGI policy, so lifting it and concretizing even the different layers of our guiding documents. But in that process, we consulted with 52 national societies all over the world, 71 IFRC staff from 27 different areas of work. So all the sectors, all the levels, everyone and their mother, and representatives from ICRC. And we surveyed around 300 people, of course, with a good gender balance in that and everything. And what we really tried, like the essence of what we got back, because we were asking questions, when is it that PGI works well? And when is it doesn't work well? Because one thing is, doing it to scale. Another thing is doing it well. And really what came out of that as a sort of a global kind of trend that you could see that this is true actually for most places and for most types of interventions is that PGI works when we have a shared ownership of our very, very jointly shared responsibility to ensure protection and inclusion of all kinds of people. And that shared ownership has to be based on a common understanding, as you've all touched on, including the link to our principles. And that bravery that Erdem has been showing through his work in Turkish Red Crescent, and all of you as well, is really very often related to that. It's related to being brave to take on the discussion when we do have different perspectives on these issues, but still insisting that we do talk about it. Let's continue talking about it. We don't have to all agree at the same time, but let's continue pushing it and developing that shared narrative and that shared approach that we need to have because of our fundamental principles. So that links to, we need to have a consistent and clear approach. We need to keep repeating ourselves. And I think all of you here in this call know that feeling very well, because we have to keep saying the same thing again and again and again, because only then we really get it under our skin as the huge organization that we are. And we need to have a shared sense of our unique value as the IFRC. In the humanitarian sector more broadly, it's very easily to be pulled in, and we need to work with partners, right? I mean, we depend on them as well. But in that process, it's maybe easy to be distracted from, wait a minute, what is our unique role as the IFRC or as a national society? And this is really important also to keep at our core, to not go astray and start doing stuff that's really someone else is much better at doing or better placed at doing. And then, as you've all mentioned also, a holistic approach, right? We cannot work on PGI in a siloed way. We cannot have anything really but the person or the people that we're trying to support at the center and at the start of everything. It cannot be run by different governments' agendas or different definitions or legal frameworks that exclude some people from receiving the protection that they need. Or from being as safe as they need to be. So working through silos is really a big part of our lessons over the last 5 years. Doesn't work that well. We need to be open to be able to talk about issues of violence, discrimination, and exclusion across these legal definitions and across these frameworks of rights, because they differ. We have the international ones, but contextually they differ, right? And whether or not people have access to the fulfillment of their rights also differ to such a huge degree. So we have to talk about the people, we know that, and we cannot fragment our work. We have to coordinate. It really does save life when we work together, and together with colleagues in other areas of work as well. So through that whole approach, of course, we've tried to develop altogether something that can guide us further, right? And it is in defining kind of our obstacles and barriers and our strengths that we can do that well, I believe. So we've ended up, as you all know, defining kind of 3 levels of work within PGI that we always have to do and keep in mind at the same time, which is a lot. So you can put on the next little overview of keywords for me there, Stephen, or if I can. No, I can't. And this is where, through this consultation, through all of your guys' experiences and your hard work, and through all of the lessons learned and the data that we're seeing, you know, we're actually also seeing that efforts or impact in PGI in one area, for example, in operations, it's not sustainable if we're not also continuously working on our institutional capacities and organizational structures, because then it doesn't sit anywhere, it's not owned anywhere, it's not systematized properly, and it's too people dependent sometimes. So as we all know, we've learned institutional capacity is crucial. We have to really ensure this across and around all of our systems and structures and levels. And we need dedicated focal points. There's no way around it. We have to have the expertise in all of the corners of the world ready and available to support on mainstreaming, but also to further innovate and build specialized services and programs. We have to contextualize our action operationally. We know that. No size fits, you know, more than maybe one person perfectly. But on PGI, efforts and approaches, it has to be culturally and geographically contextualized with language, as Evelyn was talking about. We can't talk about this if we can't use our own words. And then, of course, going to talking about this, we need to continuously try to influence, first of all, our own colleagues, our own, you know, different champions in different areas of work, to keep up with our narrative and to keep up with how important we see continuously that PGI efforts are on the ground, but also, of course, learn from partners and strengthen the collaboration on protection, gender and inclusion within the movement. So also working much more closely with ICRC and really trying to understand each other better so that we can better complement each other, right? That's the whole key here. Yeah, I think I'm going to stop there because I can talk forever about this. But thank you so much for this moment, guys. It's amazing.
Thank you so much, Stefan and Lisa. It was extremely helpful to see the data and how it informed work on the ground. I think personally, I really like having some visuals. I find it makes a lot of sense. And Lisa, thank you for your words. We know from the lessons what remains to be done, and I hope we'll be able to reflect on that. Keeping in mind the time, and we're trying to finish in about 20 minutes, I'd like to give some space for a question and answer session led by Daniel. And I hope we can get back after this session, like a couple of minutes before 5. Thank you. Over to you, Daniel.
Thanks so much, Audrey, and thank you so much, everyone. I know that we've been a little bit over, but I certainly don't regret all the fantastic testimony we've had especially from our panelists and also from our colleagues in Geneva. So please continue to put comments and questions in the chat. We've already got one question so far from Jose. We've also got a huge number of comments with glowing praise for all of our panelists, which I think is well deserved. But please continue to put comments and questions in the chat that you'd like our panelists to answer. So we have one question. This is a question for PGI in emergencies, and it's not directed at anyone particular in the panel. So I think anyone can answer. But I do think based on this, it might be great to ask Pooja to start with an answer to this. It says that in times of crisis, women and girls are the most vulnerable regarding violence. The subcluster of gender-based violence has been focused on women and girls, which makes sense. How is PGI in emergencies protecting women and girls, since it has a focus on so many different types of vulnerabilities and vulnerable people, such as people with disabilities, ethnic groups, LGBT people, etc. So perhaps I could ask anyone in the panel, but if Pooja, you're comfortable perhaps starting with an answer, how do we prioritize and protect so many different groups when we have so many different focuses in PGI? Thank you.
Thank you. Actually, we can do lots of things. We have a main thing, the minimum standard commitment to the PGI, that indicators we have, and we have a clear checklist how we can ensure their prevention of the violence and other type of the response based on that. But networking works really effective during any response, local level, national level, regional level, global level, and different working team as well. And the first of all, the institutional level commitment is needed, and the community capacity building is also needed. The self-centered and the people-centered approach really works effectively in the time of the emergency. But we never forget that we are guiding by our commitment and the policy that has to be follow at the time of the project planning and the response. It is our experience. And first, another thing, the data keeping is the most important thing. The institution and the society must have to establish the MIS system, management information system, for the clear data keeping system. That is our experience as well. And the PGI dedicated person, it is, say, we are talking about the shared leadership, and it is everyone business, everyone has to take a responsibility for the PGI response. But the dedicated person, dedicated technical person, because it is a very sensitive area, everyone doesn't have that much of the capacity to ensure these things and the gaps, because we always talking about advocating that everyone has to ensure everybody is responsible, but a special technical person is needed. In the absence of the technical person in the national society, even in the regional and the global level, the always gap we find at the time of the response. There is a gap. And the issue of the funding also, because we are working as a cross-cutting team. The cross-cutting is always not sufficient, but the different is need is very diverse, and this country to country need is also very diverse and specific. So to address those needs, we need the special kind of the funding during the emergency at a global level, and we can strengthen the regional and the national networking to respond during the emergency, I think so. And also we have experience while we are implementing in the disability inclusion project, the pilot in the Nepal, in some community and some districts, we have established the self-help group of the disability people in the community, and we capacitate them, and we want our objective to change the community mindset and the other things through the people of the disability for themselves. So they will be the key agent to change the community at the time of the emergency. So how we are participating, the people and the beneficiary is in the center, that is also the most important while we are responding during the emergency also. Without this is not our only our responsibility. We have to involve the community in the main center during the response and the emergency. Thank you. I think so.
Thank you so much, Pooja. I mean, that's very comprehensive, and I really couldn't agree more. I think especially when it comes to having dedicated PGI technical focal points, I think certainly something we've seen is a lot of national societies have to have sort of a PGI focal point is also the focal point for health or resilience or things like that. And so it's often not only, Jose, to speak to your question as well, that we've got focuses on different vulnerable groups, but that the PGI focal point themselves is focusing on other departmental thematic areas as well. So that's really, really fantastic answer. Thank you, Pooja. Okay, Evelyn, you've added as well in the chat, so that's really fantastic. If you'd like to add in of your mic as well, that would be great. But otherwise, we'll keep it in the chat and go to the next question.
Yeah, no, overall, I think it's a key mirror to highlight that working about GBV in emergencies require both a specialized approach, but also a community-based approach. In specifically Americas, GBV is firmly rooted in most of the cultural norms of our communities, and definitely the prevention of GBV is not necessarily need to be part of the response. Preparedness efforts with a PGI approach are key to make sure we have a community-based approach, working with the communities to address GBV in the preparedness efforts, to work with disaster risk reduction as well, and about how climate change adaptation affects and increase GBV is key. So working in different emergency settings, because GBV is not the same in regards to the hazard. And secondly, to work with a CEA approach. CEA and PGI are beautiful sisters and brothers, because if we do not permit to have in the center of our approach the perspective of the communities about what is GBV, the different manifestations of GBV, definitely to have a very broad and not a specific context-based intervention can make some harm.
Absolutely, thank you so much. And before we come to Huda's question, I'd also like to just draw attention to Milinoy's comment, which is why it's important that PGI is included in all emergency operations from the start. And really just to say that I think in that regard, I'm really grateful to have been part of the development of the PGI organizational capacity assessment toolkit. I think it's really, really fantastic that as part of the approaches to having PGI included in emergency operations, that from the beginning we're assessing organizational capacity, especially for emergency response. Okay, great. So I'm just going to quickly go across to Huda's question. And just to say that if we do go over with the questions, we can always add the questions to the chat, which will be open after this call anyway, and we can get responses from the PGI team. So Huda has asked, has PGI training been developed? It's actually two separate questions. Has PGI training been developed, and how do you become a part of the PGI surge capacity? Lisa, if you don't mind, I might actually hand this over to you to answer. Certainly I can say for the PGI training, we do definitely have a lot of PGI training available, but it's definitely a work in progress. But to hand over to Lisa, I think you can answer it much more comprehensively.
Thank you. I can answer it very comprehensively, or just briefly and hopefully more relevant here and now. Thank you for that. No, we spent last year, we've had lots of different PGI trainings over the years, but under different headlines. So we have SGBV specific trainings, or trafficking in persons, training of trainers, or, you know, a lot of different trainings. What we spent a lot of time on last year doing was to develop and put together all the pieces of a complete learning pathway for PGI core competencies and technical competencies. And this is available. I was trying to share the file, actually, the PDF in the chat, but I will try a bit more once I'm done talking and we continue. And so look out for the overview, because we have a one-pager that now gives the overview of the different steps in the main PGI learning pathway. And that one will also give you a bit of a brief description of the surge training, which we refer to it, which is the training / assessment process that we use to, together with the participants, assess whether a delegate is ready to deploy as a PGI coordinator or a PGI officer in an emergency response. This is a bit more complex of a process, and it has to do with the way that we're structured when it comes to surge deployments, in terms of national society colleagues seconding very often that capacity to us to support their national societies in their response to their own to the emergencies that are affecting their communities. So it's a bigger coordination process, and we have, because of COVID, not been able to do much more surge training or surge trainings the last couple of years, because that training has to be done face to face and in person, because it takes you through quite a lot of interpersonal skills training, etc. That is impossible to do online, really. But I'm happy to give more information on that in writing or bilaterally, so just reach out and I will bombard you with info. No problem. Hope that helps.
Thank you so much. It was very helpful. Okay, great. So I've noticed one more chat, a question in the chat. I'm going to have to ask if perhaps we can move back to Audrey, just because we're running out of time a little bit. But this is a very, very important question from Farina as well. So hopefully we can just flag that for getting a response from the Geneva team afterwards. So I'm going to hand over to Audrey, but just to say that absolutely the chat will still remain open after this call. So please do continue to add questions as you wish, and we'll work on getting responses as soon as possible. Thank you so much, and over to you, Audrey.
Thank you, Daniel, for facilitating this question and answer session. I think more and more we hear, the more we want to ask new questions. So continue indicating them in the chat and we'll follow up And right now, I would like to hand over to Amjad for some final remarks, please.
Thank you. Thank you, everyone, for the inspirational conversations, but also the questions, and really glad to see this happening. And so absolutely, we will keep this chat open, and please do feel free to add stuff in. Just very quickly on the very quick response for National Society development, I think it's a very important point. I mean, the PGI team within Geneva sits within the NSPKD unit. I know it's a bit different in the regions, but essentially, you know, National Society development is a key component of the work that we're doing. And in fact, I often sort of say that the PGI team is a specialized National Society development team, because we're really looking at that. And as Lisa was saying as well, that, you know, one thing that we've identified with our policy and the lessons learned is that institutional capacity is key to have that. And I think this is something that Pooja also mentioned, that if you don't have that organizational commitment, which means commitment and understanding from leadership, then it's very difficult to move forward. So really, I think that's part of it, but I can definitely share some more experiences later on. And I know that Frank, if he's still around, has a vision on how he wants there to be closer engagement between the NST colleagues and the PGI colleagues moving up in the future. So, and also, yes, Jorgo, I think CEA is also there. There's also a conversation around how CEA and PGI can work much more closer together. And one thing that is probably being worked on, just for your knowledge, is the fact that now the CEA indicators will be moved under the values, power, and inclusion portfolio as well. So it's sort of showing that perspective. One thing, of course, that was mentioned by everyone, and I think Stephen alluded to this, is the concept of resources, both human and financial, because we won't be able to do this work if it wasn't for the people behind it, and if it wasn't for the support that is there. And one thing that we have done differently for this year as part of our plan and budget, of course, we have a plan and budget planning process that we did, is we have launched a new case for support for 2022. There, as you can see that on the screen, and Stephen will share the links there, and that really summarizes the global PGI ask for 2022. What we did is that we went to the regional colleagues to look at national societies, to sort of prioritize certain national societies that we could, particularly from Geneva, support more in terms of building their organizational capacity, organizational strengths, so that we could then get them to be PGI champions. And so the case for support really looks at PGI organizational assessment. So taking an organizational assessment tool, looking at 5 countries per region for 2022. Some of these countries are countries that are not the usual suspects, so to speak. They're new countries, because we're trying to build this knowledge, build a peer exchange as well. We want to invest time into helping them to actually take this forward. We want them to share their experiences with national societies, and we want to ensure that that Geneva in particular is supporting the national societies and the regional colleagues. So you know, this has been a PGI plan that has been informed from the countries and from the regions, so that we really ensure that close complement. And so then we have the case of support looks at organizational support from an institutional perspective, looks at focusing on certain specialized programming beyond the mainstreaming. So we're looking at the subspecialist programming on SGBV, on safeguarding, on trafficking, on RFL, because these are places where we feel that there can be some value. And of course, the need to build learning and to do advocacy. So that case for support really supplements what is being done at the national level, at the regional level, and at the global level as well. So please take that, use that for your own purposes, to share with partners and with donors, and to really sort of see our total ask. And what we hope to do then is to replicate this on a yearly basis, so that by 2023, where hopefully we have the 5 national societies that we worked on this year, that will then go on to support the national societies the next year, a new set of national societies where we can build this up. And as Frank said, you know, we have as part of the flagships, we have made a very ambitious commitment to reach about 150 national societies with PGI, well, PGI proof, so to speak, with PGI leadership within the next 5 years. So there's a lot of work for us to do there, and it really requires your support and collaboration, both at PGI institutional perspective, but also safeguarding. So that is there for you to look at, for you to fundraise, for you to use to see where the priorities for the Federation are. And thank you, Stephen, for sharing that as well. And so we hope to use that. The links are here. We hope to use that for our asks for 2022, but also moving forward. All of this is currently on the website, although I know we're still migrating documents across into the new website, so some of the things may or may not be there. But if they're not, please give us a shout, and we'll be able to send that to you. But we're really hoping that that you can use that to really ask and provide the support for the excellent work that is being done by the team. And then in 5 years, we will come back and we will sort of see where we have really moved the conversation forward. But once again, from my end, it's been a real privilege to be part of the team that is doing this, to see the innovation and the inventions and the testing that is there, and to see the real commitment from people, despite the challenges that we have to do this. So with that, Audrey, I will hand it back to you for a final few words, and then yeah, hopefully we can finish on time as well. Can't hear you, Audrey.
Voilà.
Okay, now we can hear you.
No, sorry, it's on and off. I think my mic is crazy, but thank you so much for joining us today. It's been a wonderful exchange. I can't recall the last discussion we had with so many participants, which is a real testimony to the importance of the topic and how much joint ownership there is about the file. So for those who've missed the links, they've been posted in the chat, but you'll also receive an email with, of course, everything that has been shared today. And I would like to take the opportunity to thank in particular our speakers for the fantastic presentation and inspirations that they've shared. The chat will remain open, so in case you have any other burning questions, feel free to post it there. The team will reply, and also to use the PGI support email. Thank you so much, everyone, and have a nice continuation of your day or your evening. Ciao, ciao.
Thank you.
Thank you. Bye-bye.
Thanks for inviting me.
Now we can have the after party. All those people who stay late, you get free Prosecco.
I'm ready for that.
Okay. And Daniel brought the biscuits. No, thanks everybody. That was lovely. Nice to see so many old and new friends. And we'll send it indeed. We'll send all the contacts later on. Bye everybody.
Bye. Nice to see you, Maureen, in Sierra Leone.
So many National Society colleagues.
Thank you, PGI team.
Thank you. I see Sierra Leone is here.
Yes, Maureen is
Maria
here.
Larios? Wait a minute, there's so many.
This is a Sheikh. This is Sheikh.
Hello.
Thanks from Sierra Leone.
Thank you.
Thank you.
Bye, Iran from Sierra Leone.